If your baby is struggling to feed, then they might have an issue called a tongue tie. And in this video, I'm going to explain what a tongue tie in a baby is, what are the implications of a tongue tie both for you and your baby, and what treatment options are available. Now, tongue tie, which is known as ankyloglossia, is a condition present at birth that restricts the movement of a baby's tongue. The underside of the tongue is connected to the floor of the mouth by a piece of tissue known as the lingual frenulum. In babies with a tongue tie, the frenulum is thicker or tighter or shorter than usual, and this restricts the movement of their tongue, and it can cause problems with feeding. Now, a tongue tie can involve the entire underside of the tongue or just part of it. In terms of how common it is, well, it can be seen in almost 1 in 10 babies, and typically it's more common in boys than girls. About half of babies with a tongue tie have got someone else in the family who also has one, so for example, another brother or sister. So how might you know if your baby has got a tongue tie? Well, if you breastfeed your baby, you might find that your baby has got difficulty attaching to the breast or staying attached. The baby feeds for a long time or has a short break and then feeds again. They can be unsettled and appear to be hungry most of the time. They might not be gaining weight as quickly as they should, or they could be very windy with excessive hiccups or flatulence or farting. You may also notice that they have difficulty controlling the milk flow. This is presented usually by the baby coughing or choking, and they may make clicking noises when feeding. You yourself might have sore or damaged nipples, you might not produce enough milk, you may get mastitis, which is inflammation of the breast more than once, and you may also just feel exhausted from having frequent feeding and having an unsettled baby. Now, if your baby's bottle fed, you might find that your baby is again taking a long time to feed. They only take a small amount of milk at each feed, they dribble a lot during the feed, they can again be very windy, they may again not be gaining weight as quickly as they should. Now, of course, many of these symptoms are very common in new babies, and just because they have them, so for example, they're very windy, doesn't mean that they have tongue tie. But if you've got any concerns, especially about how your baby's feeding or putting on weight, then speak to your health provider. Now, if a tongue tie is suspected, a feeding assessment can take place. With your permission, a referral will be made to a tongue tie specialist. A referral doesn't mean that your baby will definitely be offered treatment, but the specialist will be looking at many different factors and will talk you through the findings and options that are available to you. So how is a tongue tie treated? Well, tongue tie release is a very simple procedure, particularly in babies under 6 months of age. The procedure usually only takes a few seconds and it doesn't require an anaesthetic. So this is a medicine that's used to numb sensation in certain areas of the body or induce sleep. Babies are likely to cry immediately after the procedure, although the majority of babies cry for less than a minute. It's considered a safe and simple procedure which demonstrates significant improvements in feeding, particularly breastfeeding, where a reduction in nipple pain and improved ability to latch onto the breast has been consistently identified. Now, before the procedure, it's recommended that if your baby is going to have it, your doctor will discuss it with you in more detail, including the reasons for doing the procedure, as well as possible risks, and they'll ask for your consent. In the UK, your baby must have had either the vitamin K injection or the second dose of oral drops if they're having oral vitamin K more than 24 hours before the procedure. You'll also need to confirm that your baby's fit and well with no known medical conditions at the time of their feeding assessment. Now, if you or your baby's father has a blood clotting disorder or there's a family history of blood clotting disorders, please discuss it with the medical team during your baby's feeding assessment. Now, during the actual tongue tie release procedure, the team will usually wrap your baby securely in a blanket and hold them gently to keep their head still. Now, it's important to remember that some babies may not like this and they might cry a lot. The doctor will then release the tongue tie using sterile, round-ended scissors. They'll then apply some pressure underneath your baby's tongue to stop any bleeding using a piece of sterile gauze, and typically there's only a few drops of blood. Now, once the tongue tie is released, your baby will be unwrapped and they'll be encouraged to feed right away. This is going to help your baby's tongue to move, and it may prevent the tongue tie from refusing or coming back together. Now, typically, you'll be able to remain with your baby for the duration of the procedure, or if you prefer, your midwife can take your baby to a separate room to have this done with the medical team. The decision to have your baby's tongue tie released is a personal one. If you choose not to have the procedure, you will be supported to give you feeding support. And if at a later date you're concerned about your baby's feeding, you can always go back and speak to your doctor for a reassessment, and they can re-refer you for another assessment if needed. Now, after the procedure, a small white blister might develop under your baby's tongue in the first first couple of days after the procedure. This is typically considered to be painless and doesn't usually interfere with feeding. You might also find that your baby can be fussy and unsettled for a few days after the procedure, and it can take a few weeks before your baby is fully comfortable when feeding. Occasionally, the procedure may not improve a baby's ability to feed. Now, there are some possible risks that the medical team will talk you through before doing this procedure, because like any procedure that involves a very small bit of surgery, there are some possible risks, but these are rare. And these can include things like excessive bleeding, infection, pain, or damage to the tongue and surrounding structures. Very occasionally, a tongue tie might reoccur if the frenulum refuses, and this may be due to a residual or leftover bit of frenulum or the development of scar tissue, and if this happens, a further procedure might be necessary. Now, typically, long-term there are no problems. However, there are some instances where children who have a tongue tie may have difficulty producing some sounds when they learn how to speak. Now, usually, these speech difficulties are noticeable by the time that your child reaches 3 years of age. So if you think they're having any problems with their speech caused by a tongue tie, speak to your doctor or health visitor, and they'll refer your child to a speech and language therapist for a full assessment. Please see the resources description in the box of this video, and if you learned something new, please consider liking the video, subscribing to the channel, and sharing this video with a friend.